Okay. So hi everyone. My name is Michelle Valiukenas, and I'm the executive director of the Colette Louise Tisdale Foundation. This foundation was set up in honor of our daughter who died at 9 days old in May of 2018. She had been born 16 weeks premature after I was hospitalized with severe preeclampsia and was in the hospital for 3 weeks. And so we founded this organization in her memory, originally really to address the financial burdens that we were seeing families go through during these stages and during these crises. As the organization developed, we also branched out into education advocacy on topics related to parenting, to general well-being, to infant health, maternal health, and the like. Our financial assistance program to date has helped over 600 families since September of 2018 and hit 39 states, and we have given away a little over $600,000 in financial assistance. So it has been a huge thing, and now we are really also focusing on some education. And for that, I am so thrilled to have Monique Wheeler with us, who is an acupuncturist with a business in Chicago, Midheaven Acupuncture. I always love supporting female-owned businesses, so really thrilled to have her. And she's going to talk to us about what acupuncture is. And I will say, I am a huge proponent of acupuncture in my personal life and have used it for a multitude of things. And anytime I mention it, I get a million questions. So I'm so glad to have an expert and not just me to give us an overview, provide some questions, answer some questions, and hopefully help with whatever journeys you might be on. So Monique, thank you so much for being here. I'm so thrilled to have you. And, if you can just kind of start off with talking about what acupuncture is and what it can be used for, that would be great.
Sure. And I want to apologize in advance. I am having a cat party that just started in my back, the noise behind me. So they're just running around, but it sounds loud. Yeah, thank you so much for having me. And what an amazing organization you have. I did not realize the breadth of your help. And so that's really great. I work with a variety of types of patients, but one sector of my practice is definitely working with women who are trying to get pregnant. And so I know the stress around that peripherally from them. Sometimes it's very stressful, sometimes it's not, financially or otherwise. Usually there's some stress though. So that's not the answer to the question. So acupuncture is part of a bigger medicinal system, which we would call, sometimes people call it East Asian medicine or Chinese medicine. It's practiced in a lot of Asian countries. And acupuncture is, of course, the insertion of very fine needles into acupuncture points with the goal of helping your body heal. And that can be helping you with something you don't have, like energy, helping you have more energy, or moving energy that's not moving well in your body. So it's very adaptive to you. It's really focused on what's happening in your body at that time. And the rest of the system of medicine includes things like Chinese herbal medicine or herbal medicine. There's something called Moxibustion, where we take a herb and burn it near your body. It doesn't burn you, it just creates a warming effect. There's meditation, which is called Qigong. There's nutritional therapy. And then there's also Tai Chi, or like a movement therapy. So there's a huge, it's not, acupuncture is the most well-known aspect of this type of medicine, but there's a lot of different parts to it. And the main thing that I do is acupuncture, but it's kind of good, I think, for people to know that there's a lot of parts to this medicine. And sometimes I'll say to people, like, please don't eat ice cream. It's not going to help your situation. And that's because of the theory of Oriental or Chinese medicine around eating cold, sweet foods and their particular situation. So we have acupuncture channels that run throughout the body, and then there's points on those channels that have specific functions. And then when someone comes to me, I have a conversation with them about their chief complaint, but I ask a lot of questions about whatever is happening in their body, which may seem unimportant to them, but it is going to give me a clue to what's needing to be adjusted in their general health so that they can achieve whatever their health goal is. And the points on the body are described. We have 360, I want to say, described points, and then there's lots of other extra ones. So every acupuncture treatment is generally different. You probably know this since you've had some. There are some points that are very powerful that we use very frequently, but it's really tailored to what's happening in your body that day and what we're trying to achieve as a goal overall for your health. So I hope that answers the question. I don't know. I don't want to give too much information.
No, I think it definitely helps the question. And, I think it's always great to paint it in. It's, we talk a lot about sort of creating your own toolbox, right? So that this is not just in Chinese medicine, is this one tool in the whole complete toolbox, but it's also one tool that people can use. But I really like hearing things like meditation is also part of it, so that we're really including, kind of whatever works for the individual person. So can you kind of walk through a little bit of what, what the actual active acupuncture does, right? Like I remember getting a lot of questions and I still get them like, doesn't it hurt? What does it look like? So sort of, just talk through what a normal acupuncture appointment tends to look like, and timing and all of that kind of thing. That would be great.
For sure. Yeah. And the way that I practice is I see individual patients in a room by themselves, in a treatment room. Some types of acupuncture see folks in a community setting, which is more than one person in that room. I prefer to work one-on-one with folks. I think I mentioned this to you. I've definitely worked with women who have had late pregnancy losses. And I've worked with women who've had traumatic birth experiences, as well as women who've just had, a normal pregnancy and a normal delivery, which is still, quite an intense experience. So there are things that people maybe want to talk about that I don't, isn't appropriate for everybody to hear. And I want all my patients to have that privacy. That's really important to me as a person who receives acupuncture. I like to have that type of a treatment myself. And so that's the way that I practice and the way that I feel I can be the most effective. But what happens is when someone comes in, I have a pretty long form for them to fill out about their chief complaints, if they have more than one. And then I ask a lot of questions about their general health, like how's your digestion? How's your menstrual cycle? What happens every month for you? Around your menstrual cycle. If it's a woman who's trying to get pregnant, I really want to know how many days between, your first day of bleeding and your last day of your cycle before you start the next one. I want to know what's happening the week before your period starts, what happens around ovulation. I try to find out as much information as I can about that. And then I ask them other questions too about the history of that part of their life. I ask questions about sleep, about emotions, about stress that's happening either around this situation they're in for, any pain they're having. So I want to get a really complete picture as well as a very detailed picture of what the chief complaint is. You're familiar with this, but a lot of people it surprises them, but I look at my patient's tongue. The tongue is a microcosm of the body. And so in Chinese medicine, different parts of the tongue relate to different parts of the body. And I look for general information about your tongue, the color, the size, the shape, if it's coated, if it's not. And I feel the pulse in both arms at the wrist. And the pulse is also another microcosm of the body. And it tells me about different parts of your body, different parts of your organ systems. They relate to different, each pulse position relates to different areas of the body. And then I actually just observe my patient. I want to see what color your skin is. How do your eyes look? I look at, like, I do treat a lot of pain too. I'm looking at, like, if you have an injury, is it swollen? What does your right knee, which is painful, look like compared to your left knee? And then after we do, the basic kind of intake of an initial exam, that is about probably 20 minutes, maybe 30. It sort of depends on the person. I have my patients on a massage table for their treatment, either on their stomach or on their back. And then I have them get comfortable on the table, draped appropriately in usually towels or sheets. And the tables are heated. I have one table that has a special mat with all these different stones in it. And ideally, patients are going to heal the best if they're relaxed. So we're trying to create a relaxing situation for them. Many people are afraid of acupuncture needles because their experience with needles is a hypodermic needle, which is not the same thing. Hypodermic needles are much bigger. They're also hollow because they're trying to put something in you or take something out. Generally, folks feel acupuncture needles. They feel usually like a pinch. Sometimes you feel a tingle. I mean, there's definitely places on our hands and our feet that are more sensitive. So patients will sometimes feel those more. My goal is not for you to be in pain. I check in with my patients during the process of inserting the needles. I first clean. When I step out of the room, I come up with a treatment plan for you that day. But when I'm in the room treating the patient, when I return, I have a way of practicing where I feel your pulse while I do the treatment. So I'm trying to see what's changing in your body with what I'm doing. And I will palpate or press on different parts of your body to find points that are going to be the most useful to you. I use rubbing alcohol to clean the different areas that we're going to do the acupuncture on. And then after inserting between maybe 6 and 15, sometimes a little bit more, sometimes a little bit less needles, I leave patients in the room to rest for 20 to 30 minutes. I check on them at about 10 minutes to make sure things are comfortable. And that time, the energy is moving. Your energy is always moving between these points and through these channels. But say, for example, someone is incredibly tired. They aren't sleeping, or for some other reason, they're very fatigued. Maybe they have had a whole lot of work that's worn them out. What I want them to do is to get up from the table and have a little bit more energy. So usually I can feel that in their pulse. If they're fatigued, I will choose certain points. And a lot of times if they're doing something like they're trying to get pregnant, I'm trying to build their energy up. One of the things that's really helpful to go into pregnancy as healthy as you can possibly be. It also helps, to get pregnant if you're as healthy as you possibly can be. So it takes energy every month to ovulate. And so I want to really support my patients with that. The needles are retained for 20 to 30 minutes, and then I come in, remove the needles, and then I'll some accessory treatments, sometimes including cupping. I don't know how familiar you are with that. It's the application of cups using a suction method. I use glass cups in a fire method. It doesn't burn, but I don't use a suction cup method anymore. I also do something called gua sha, which is where we rub the body with a hard implement similar to cupping. You can do it on the neck, on places on the body where a cup won't really work. And I often do a little bit of a massage, or I use some essential oils on a patient to try to get them ready for leaving the room and going on to the next part of their day or their life. With the first appointment with me, it's usually between 60 and 90 minutes, and then follow-up treatments are usually 60 minutes. I tend to take a long time with people, so sometimes it's like 75 minutes when you come back. But generally, yeah, that's what the process looks like with my patients. We're looking over time to reach a goal with folks. Like if they want to come in and get pregnant, first I'll look at their cycle, perhaps if they're doing only natural. support for pregnancy. And so if they're having a 24-day cycle, I want to know what day they're ovulating. Do they have cervical mucus? Is it, obvious to them? Do they have any pain around ovulation? And we're trying to find out what day they're ovulating. If they're ovulating too early, I want them to ovulate a little bit later if you maybe have a 28-day cycle. So we start trying to influence that with the treatment. I also recommend herbs and food, like we talked about. And then over the next month, I expect to see some changes. So that month, the first month that I see someone, hopefully maybe if they have a very painful period, it won't be as painful, but if they ovulate early, that would show up in the next month or two. So it's a relationship. It's definitely, I see my patients weekly initially, because there is a very healing aspect to having that time, I believe, together. And that's what happened with me with acupuncture. That's how I got to become an acupuncturist, was my own experience with it, not with fertility, with my other health concerns. And I see an acupuncturist a couple times a month, maybe more often sometimes. And it's very valuable time to me. And I really appreciate that relationship.
Yeah, and I think that that's so key, is sort of the relationship and seeing things as they go. I know I've used it at various points, for some, pain, for fertility kind of issues. I used it post-loss, for some of that recovery kind of thing, and then trying to conceive again, and then just general stress and anxiety. So I've definitely seen it all through that. And, I really do have to say, I've seen a couple of acupuncturists and how in tune they can really get with your body. I always remember going to an acupuncturist who was like, "Oh, did you start your cycle?" And I was like, "No." And, in my mind, in my sort of schedule, it was, I had a few more days,
Yep.
and sort of walked off being like, "That was weird. Okay, whatever." And that night I started my period.
Nice.
And so, sort of that kind of thing where I was like, damn, okay, actually they do know what, they're talking about. So you definitely talked about a bunch of different, areas that
Mhm.
it can be used for. So one thing, I was hearing a lot from people is, obviously in COVID, this is happening, but this is happening no matter what, where, we might be in chronic stress conditions, and
Yep.
whether that's, just managing, kids and work and family and all of that, or whether that's going through fertility treatments or, any of that. So when, we're talking about chronic stress, and obviously, adding in a 60 to 75 minute, time a week might cause more stress. But what kind of things, how often are you seeing patients for that kind of condition?
Oh, sure. Yeah. Well, and if it's causing stress for someone to come for acupuncture, then that's, counterintuitive and contraindicated, right? I've definitely had folks who, I'm in Chicago and in the city, and I've had people who are out in the suburbs and they say, like, I want to come and see you. I live in Schaumburg. And, I think like that's just a bad plan, because often the traffic is really not great. Now, if you have another reason to be here, wonderful. I'd love to see you, but I certainly don't want somebody to get blissed out on the acupuncture table and then have to be, in crazy amounts of traffic. Um, so there's a lot of different ways that people can sort of make use of acupuncture. Essentially, if somebody comes and they have a chief complaint, like they want their knee to stop hurting, their shoulder to stop hurting, have more energy, sleep better, be less anxious, have a baby, whatever their situation is, I'd like to see them enough times to really get them to a stable place. And then we start spreading out treatment. So there's that kind of perspective. And then there's other things people can do, of course, to help themselves with stress. And I can bring those ideas to them. But if you're in a constant state of overstimulation, in the fight or flight mode, one of the things that acupuncture does is it turns on the parasympathetic nervous system, or it gets you out of the sympathetic nervous system, which is the fight, flight, freeze. I think they've added freeze to it, and into the rest and digest. And the parasympathetic, that's rest and digest, is also important for fertility, because if you are running from the bear, you don't have time to, like, your body is not putting energy toward reproduction because you are in full flight from a very dangerous situation. And so I'd like people, and I think you're right, COVID has really put us into a high stress situation. And I think it's been stressful for a while in the world. The world's always maybe been stressful, but I think stress has gotten worse. And one of the things that acupuncture I've been doing since the beginning of the pandemic is doing trauma points or trauma protocols on some of my patients who are very stressed out by the situation. Um, there's a lot of points. We use the ear in Chinese medicine. There's a point protocol in the ear that's very helpful. It's called the NADA protocol. It was developed in New York City, like in the 70s. It's not, the points weren't found then, but a doctor who was working in a substance abuse clinic started using them with clients. And he saw that when he used these the patients, so the clients who used these points or came in for that clinic, had a higher likelihood of, I believe, of getting sober and staying sober from drug use. And I've worked with people who have been in very traumatic situations. I was years ago had a patient who witnessed someone almost drown, and she thought it was her husband. It wasn't her husband. It was a swim club, and a man had like a heart attack or a stroke in the pool. And what happens when we're in a traumatic event or have a traumatic experience is our brains sometimes just loop that over and over again. So even when you're trying to sleep, you're in that scenario. And the thing that acupuncture can do, especially I've seen with the NADA protocol, I did it with her, is let's break that cycle. So you can kind of like release that thought or that process and be in your day rather than in that historic moment. So yeah, it's really effective. Now, we're still in quite a stressful time, so I won't say like, oh, everybody's always, they come back and they're not stressed anymore. And of course, we go back into our life and we get stressed. So I do love meditation. I recommend meditation to folks, and it doesn't matter to me what that looks like. You can do a seated meditation for 3 minutes. Sometimes I teach my patients about grounding in their body, getting connected to their body, because that's really important when you're trying to achieve specifically something like having a baby or getting pregnant. But I think it's, really important for all of us to be more connected to our body, because we're in these boxes on these screens all the time, right? Or looking at our phones and not maybe so present in our world. Chinese medicine is essentially based on Taoism, and it's the idea of being in harmony with the seasons. So like with every seasonal change, our bodies will change. In the winter, we need more rest. In the spring, we can start to move more. We start to get antsy. In the summer, we can eat food that's not cooked. So I try to talk to people too about how the season's affecting them and how they can be in better alignment with the seasonal changes and listen to what their body needs that season. Yeah. So and also people, maybe acupuncture is not right for everybody. If you are really deathly afraid of needles, that's probably not the best idea for you. And there's lots of other things out there. But I think the one thing at home is just getting that quiet meditation time, and not always being in front of a screen if you can help it. Yeah.
Yeah, those are some great, tools and suggestions and some great things. You talked about the trauma. And so obviously, I know, we're kind of in this and have been in and out of, or maybe constantly in this kind of trauma state. But, we talk a lot about when we talk about loss or even, successful pregnancies, whatever, where there's a lot of trauma, right? And so people can have traumatic births, traumatic incidents in pregnancy, and they can also have, after loss. And so, and a lot of times in the world, we're hearing about the trauma or PTSD and that kind of thing. And you were talking about the loop, and I can definitely attest to personally, after losing Colette, of feeling like I was constantly in that loop of losing her and constantly in that loop of her birth, which was traumatic. And how does that really work for somebody to be able to come and, work through that with acupuncture?
Yeah, um, I see a variety of people who have experienced trauma. I wouldn't say that it's a specialty of mine, but I've done my own therapeutic work on trauma. If someone has had a loss like you're describing, I definitely want them to have their own personal therapist that's trauma informed. It is amazing to me what can happen through that process and how people can get such great support and really be able to not shut the door on what happened, but realize what happened and not be in that state of constantly being, in a trauma spiral or loop. So I definitely want to have a team if someone has had that happen. I don't want to be the only person working on them. But one of the theories or one of the aspects of Chinese medicine or acupuncture is that we hold emotions in our body. And if we don't process them, we become ill. So that's somewhat accepted in Western or allopathic medicine, specifically around things like heart attack, right? So there's definitely type A personality. If you don't handle your stress for 30 years, you're going to potentially have a heart attack when you're 50, right? Usually they're talking about men, but it can be women too. But in Chinese medicine, it's not just stress and anger that we're like sadness, fear, grief, same thing maybe as sadness. If we don't find a way to help our body go through the process of whatever the emotion is rather than stuff it, then the idea is that we will become ill because that organ that's affected by that emotion, all the organs in Chinese medicine are assigned a certain emotion. Like the lungs are related to grief, the heart is related to joy, the liver is related to anger, the kidneys related to fear. So if we aren't attending to those emotions, then potentially that organ system can become quite ill or have dysfunctional is probably a better way to say it. And one of the things that I've noticed, and maybe people have noticed this too, is I've seen folks go through a loss, a family member dying or a pet, some sort of loss, and then they become sick with a respiratory infection. And that is this connection between the lungs and grief sometimes where we're not able to process that grief. We don't have I don't think Western culture is, or maybe American culture, I should probably say, encourages those times to take time to deal with your emotion. That's not usually what I have heard in my own life. It's sort of like, okay, that happened. You can get some help, but go right back to work. Go right back to your life.
Right. The whole move on phenomenon, right? Close that chapter, move on.
And it's not that clear, right? I mean, sometimes you get to over one hurdle and then there's some other stuff that we have to look at. So yeah, I do treatments that support your ability to process the emotion. Sometimes that's patients crying when they're on the table. I certainly don't want anybody to be miserable, but I would much rather you were able to cry than not able to cry. And it's not going to be an overnight thing, but I want you to feel secure in your ability to handle it. Like there's people there for you, me, others, and that the experience of the emotion isn't going to kill you. And I feel like that, sometimes is a fear people have, which is not, it makes sense to me, but in my experience, not processing an emotion is much worse because it's going to come out some other way, some other time.
Right. Right. Yeah. And, I've shared this before, but, especially with losses and traumas is they don't go away. And so just in my personal life, my grandmother now is, dementia, possibly, Parkinson's, and her memory is definitely going. And one thing I noticed, was my mom called me one day and was sort of like, I don't know, she just keeps talking about her baby and this and that. And we were expecting kind of we were at the any moment for our little guy, who's 9 months old. And so she said she must be picking up on like you guys expecting. And as she was telling me this, I finally said, did she ever have a loss?
Mm.
And my mom said, you know what? Actually, now that you say that, she's never told me, but my grandmother told me about. She had a loss after, kind of the three kids that we knew of. She had had a fourth loss. And really just, even in this, hadn't processed it. So she's in a lot of ways and, still ongoing where she relives it. And so there is something to, being able to process that and the effect it has on us long term. So yeah, for sure. And one thing I like that you hit on, and I think that this is really important, is, I think acupuncture sometimes in this country gets a little bit of a rap of being very woo-woo, very out there, all of that.
Yep.
And you talked about American culture. And, I think one thing that's interesting, and definitely when we were struggling with fertility, I was definitely seeing this and, have since, is how often acupuncture is used right in direction, right, like, hand in hand in other countries with sort of the traditional medical doctor, that those are really, hand in hand. And so I know in, areas of Europe that have fertility centers, for example, the doctor working on the fertility also has acupuncturists on staff to kind of work together with those things. So I think that's really interesting that, you brought up about American culture. And I do think that that's true, because in other countries, it's not seen as that. It's seen as another tool in the medical belt, and yeah.
Well, and I think it's changing some in America. One of the things that's happened is there's some research that was done in the last 20 years on acupuncture being used during assisted reproduction process through the IVF process, and the outcomes of women who receive acupuncture during that process, as opposed to women who aren't, having a higher incidence of achieving pregnancy and also live birth. So that's convinced a lot of the reproductive endocrinologists, like, oh, okay, well, we've got these research articles, great. And that, I'm glad that there are physicians out there, and certainly difficulty conceiving or having fertility issues is incredibly stressful. There's so many aspects to that cause a lot of stress, and stress does not help women get pregnant. So, at the very least, if we're reducing your stress and putting your body back in that relaxed state, you're going to have a easier time, in my experience, conceiving. But I think the other thing that's happening in a different part of American culture is sort of the pain problem that we have, or the opioid epidemic, right? So doctors are now more interested in, oh, how does acupuncture work for pain? And so that's, I'm grateful for that interest too, because that's another very common thing. And if someone is trying to get pregnant and they have a lot of pain, that's not going to help, right? I do treat women in pregnancy who have pain, because of course carrying a baby is hard on your body in a variety of ways. So I think it is changing somewhat here. We don't have, of course, any kind of nationalized medicine, and so I think that is some of the reason why in some other places in Europe maybe they have an acupuncturist as part of their medical program, and everybody can access it. I mean, I think that would be really great. I don't know if that'll ever happen in America where that would be a possibility, but I do have more and more patients who have their doctor say, like, hey, before we do surgery on your hip, why don't you go have some acupuncture treatment? Or, try, if they don't really respond to physical therapy, or they get some of the relief but not complete relief, then come in for acupuncture or see a chiropractor, or another mode of hands-on healing. And for me, I just, it's nice to have someone, especially in COVID, touch you, because
Mhm.
a lot of people are pretty isolated. I've been able to practice almost the whole time during the pandemic. I did close my clinic for about 6 weeks at the beginning when we were all initially sheltering in place. And I have had no problems with anybody with an active infection coming into my office. So I've been very, very lucky. I haven't had COVID myself, knock on the wall, and I was able to get vaccinated. And, you know, um, I feel like this has been such an isolating time for many, many people, and they haven't been able to get all the care, maybe because of whatever the hurdle is. And so now it's getting a little bit, easier for folks to get out and do that. But I think it's just important for people to be touched.
Right.
So
Yeah, definitely. Yeah, and I think, that's always something I've reported, is just having that time for yourself. And I have definitely kind of passed out and slept during, having needles in me,
yep.
because that has been the case. Just recently, my husband and I were kind of talking about all the different fertility treatments I had been through and all the different medications, and those are tough on your body. Like some of them, and it depends. And I remember at one point they tried me on a pill that just used to kick my ass. I mean, there's no other way. And I
Totally.
would go to acupuncture once a week, and that was like how I managed to get through with,
Yeah.
the few times, taking that pill of like I could then be okay. And
Yeah.
I did it Tuesday nights, and so I could make it through at least through the, to the weekend, and working full time, that was what I needed.
Yeah.
And then, maybe Monday I was a little draggy, and Tuesday definitely during the day I was a little draggy, and then I would go back again, and then I would feel that. And that was how I managed it. And just having that time and space. And I think, yeah, and definitely hitting the points that are right, and doing that. Um, yeah, so we've talked a lot about different things, and I know some parents will be watching and things.
Yep.
Is acupuncture something that can be used on babies or kids, or if you're
Sure.
familiar?
Oh no, yeah. I don't. The youngest patient I have right now is well, I started seeing him when he was 14. His parents are my patients. And he was having a lot of trouble with getting sick frequently and just not feeling very good and athletic. And he loves to come. He loves to come in for treatment, and he loves to get cupped. And it's really, he's a great kid, and it's really, I enjoy treating him. By the time he was 14, he was pretty tall. I think he was like 6 feet. So he's pretty, not, he was, I would consider him almost an adult. I have treated children. I think maybe the youngest was 8. So I don't personally see babies. There used to be a practitioner here in town. He's a pediatrician, and he's also an acupuncturist. His name is David Miller, Dr. David Miller. And he actually left Chicago and went to the Cleveland Clinic. And he's like the head of their integrative medicine program or something now, which is really awesome. There's definitely treatment for babies. It's not the same. The points, as a human grows, the channels, of course, move a little bit, and they become. My understanding is they're in slightly different locations when you're a baby. So
Mhm.
a lot of times with babies, there's massage that's done. Practitioners will teach the parents how to do the massage. There's definitely herbal medicine for babies that's completely safe. It's many of the Chinese formulas that I use are actually pediatric formulas, and then they get used for adults too. And so, yeah, I'm not 100% sure who is doing that locally, but there are acupuncturists who do definitely treat children. Now, I will treat a lot of times a mother who's not feeling well. And sometimes we treat the mother if they're breastfeeding to help the baby.
Mhm.
So that can happen too. Like if, sometimes women at post-birth are pretty wiped out, and then they're breastfeeding and they might even be more wiped out. So I'm giving them what we call tonic formulas. And so they're just highly nutritious, mineral rich, dense with vitamins and nutrients, herbal formulas. And some of those are probably being passed to the baby through the breast milk, which can be helpful too. And so I do know there is that theory, but I'm not a pediatric specialist, so it's not really my my area, but it can, I have recommended it to many patients to see Dr. Miller when he was in town, especially if they had questions on vaccine schedules, or what do I want, what do I do right after the baby is delivered, with questions of like direct baby health as well as like postnatal mom health. So I work with the postnatal women, but for the babies, I'd have to look for somebody else locally.
Right. And I imagine, if we're addressing a parent and stress, I definitely know that my son sometimes picks up on my stress and that kind of thing. So if we were reducing it in parents, we're reducing it inevitably in kids as well. And so there is something to that as well. So, you kind of alluded to a little bit with meditation in that, but are there techniques of acupuncture you might recommend to people at home? So if if right now I just can't fit an acupuncture appointment into my schedule, are there techniques I could use at home to help?
Yes. So acupressure is the application of pressure at different points. And I have taught patients how to give themselves an acupressure treatment, or give it like when a woman is about to deliver or go into labor. There's certain points that I will recommend that they have their partner or someone else massage for them, try to help their body get ready. So for sure, you can give yourself an acupressure treatment. There's points that are helpful for headaches. There's points that are helpful for stress. There's points that are helpful for nausea when women have, morning sickness, which is not in the morning, but when women are, feeling nauseous in early pregnancy, there's a point on the middle of the wrist that can be really helpful. So yes, absolutely. I can recommend to people, here's what you can do at home. I have offered a couple of different classes specifically too in the pandemic that were acupressure points to do on yourself for respiratory health and immune health. There's been one study for sure, and I'm sure there's been other studies in Asia on using acupressure this one study that I read was improving lung volume, or oxygenation of the lungs. So that's, something that you can do on yourself. There's a book called Energy Medicine. I think a woman named Donna Eden wrote it, and it's all about this emotional freedom technique, I want to say, which is tapping, where you can tap on different acupuncture points, specifically on the face. That is her protocol to help people relax. But yeah, there's a lot of, it can be overwhelming, but sometimes, specifically if I'm not going to see somebody for a while, or a woman is having, morning sickness, or early in pregnancy, if they're concerned about, losing the pregnancy, there's a point on the top of the head that I will put a needle in, but I will say, oh, when you're just sitting watching TV, can you just tap this point? Because it lifts your energy. That's what we want to do. We want to encourage that baby to stay in there. And, I also think it's nice for people to have things to do that they feel empowered. Take care of this part of my life. But yeah, you could, I think there are definitely a variety of protocols and acupressure points that people can use. And I love a hot bath with some Epsom salts. So that helps really well. If you in a relaxed state.
Yeah. Great. What suggestions would you have for somebody who maybe is going to start acupuncture for the first time, and whether that's, what kind of things you should look for in an acupuncturist, would you suggest?
Sure. Yep. There's, so every state licensed acupuncturist, so you can,
find an acupuncturist in a variety of ways. Someone can recommend one to you. You can try to find one that's local, near your home. I definitely wouldn't, I mean, if you have to travel far, like say you live in rural Michigan, maybe you do have to travel for a ways, but hopefully you're looking at beautiful fields and not, somebody's taillights. I would try to find something that's convenient to you, someone, that you resonate with, that there's a national website, the NCCAOM, and that's a nationally accredited program. I had to get my license in Illinois through the state, but I had to take the national test. Every state has a little bit different requirements, but you can go to the NCCAOM site and find someone that way. I think it's important that patients feel comfortable, so they're willing to talk to their practitioner about what's happening. And that takes time to build that trust for sure. But, I would say you want to find somebody that you feel like you could at least get to that place with them. And, hopefully they have some experience with what you're dealing with. That being said, there are some very unique health conditions and that I may not have seen before, but I will be able to help someone with. And that is because the premise of Chinese medicine is that what we're going to discover is the pattern of the problem that you have. And so you could have a migraine, or you could have high blood pressure, like two different patients with both of those symptoms, and they might have the same pattern. Or two people who have migraines might have completely different patterns. So it's not like one size fits all. We're going to tailor the treatment to what your condition presents as. You might have too much yang going up if you have migraines, or you might not have enough yin to hold the yang down. And so there's a lot of different ways that we're going to tweak what we do with you to get the problem solved, I should say.
Right.
So I personally think I don't mind it. I mean, of course, I talk to folks if they want to talk to me for 15, 20 minutes before they ever make an appointment. I'm happy to do that. I have a lot of information on my website. I have videos online of me talking so that you kind of can get an idea about my personality, sort of like a therapist. I'm not a psychotherapist, but you want to feel comfortable with that person. Right. So I do think that that's a really important thing. And there's hopefully a wide variety of ways. And then sometimes you just pick somebody randomly and they work out great. So
right.
That happens. But here in Chicago, we have a wide variety of practitioners, and I see men and women. Sometimes, men may be more comfortable seeing a man. I'm not 100% sure, but lately I've had quite a few men coming in, which is great.
Mm-hmm.
Yeah.
Yeah.
Being comfortable is really important, though.
Right. No, and I think your comparison to, finding the right therapist, or, and I was thinking even like the right doctor, whoever you feel comfortable with, and not to stress too much about, it's not going to do any harm if you find one and you go one or two times or more than that, and then decide this is not the person that works for me, and kind of, reassessing and finding somebody else. And I think that's, that's very key. And I will say that the first acupuncturist I worked with, who didn't have a specialty in fertility, once I got far enough into the assisted reproductive technologies, she said, I think you need to see somebody else, and referred me to somebody in the same office, but to somebody who had a specialty in fertility. And that was, strange to change acupuncturist, but yeah, definitely where she knew everything I was talking about, and I wasn't having to explain what certain terms meant, and that was a big deal. Yeah.
Yeah, for sure.
Yeah. Any other kind of parting words of wisdom? This was so helpful, and I hope everybody watching it is feels better informed. I will share, if it's okay with you, Monique, I will share your contact information as well in the post. And so that should be in the notes of this video. But any other things that you would say?
I don't think so. I think we covered a lot. I guess the only other thing I wanted to say is when people have a question like, is this going to help me? normally what I say is the best way to know is to try it. And say you come in and you're working on pain or you're working on stress, it's not going to go away usually with the first appointment. Now I've seen some miracles happen where people get really dramatic results from one treatment, but that's not the norm. But you should notice something. It should feel right to you. And I have people call me and they will say like, what can I expect? And that's generally what I say. If you have pain, we want to see it diminish. If you have stress, we want to see, you have like a change in that. So that's, I think, the way that people can know best if the treatment or the person is really right for them, which is an investment of your time. But I do think it's a useful tool or a way to perceive it.
Right. Okay. Well, thank you so much, Monique. This was fantastic. I'm so glad you were able to join us.
Thank you.
And yeah, I hope this is helpful. So always continue following us. We have quite a few other presentations in the works, so we will continue to share that. Very big thank you to Monique. And if you're ever interested, this information will also be in the notes, but you can visit us online, and it's Colette Louise. Colette is 1 L and 2 T's, Louise.com, and we'll continue to share those as well. So thank you so much, Monique. This was great.
You're welcome. Thank you.